Hello, my name is Yasha, nurse practitioner. What brings you here?
Wellness exam.
A wellness exam? Okay. Any problems or concerns? No? Okay, can you stand for me? I'm going to have you just take a couple of steps towards me and then walk back. Okay. Patient is well groomed. No distress noted. Patient's gait and posture are intact. No problems with mobility. I'm going to begin the assessment by inspecting your head. Your head is normal cephalic and atraumatic. I'm going to begin to palpate your scalp. Any tenderness noted? No? Okay, hair is evenly distributed. No tenderness or lesions noted in the scalp. Now I'm going to begin inspecting your facial features at rest and at motion. Can you raise your eyebrows for me? Can you frown? Can you smile? Clench your teeth. Okay. Open. I'm checking for TMJ. Any tenderness? No tenderness noted. TMJ open smoothly. No crepitus noted. Can you close your eyes and open against my resistance? Okay, great. I'm going to palpate her lacrimal glands. They are non-palpable. I'm going to begin palpating her sinuses. Let me know if you feel any tenderness when I palpate. No tenderness? Okay. Now I'm going to begin to inspect your eyes. Okay, can you just look forward for me? Okay. Okay, sclera, conjunctiva, and retina are intact. No drainage noted from the eyes, no redness. Her pupils are equal, reactive, round to light and accommodation. I want you to follow my pen light. Okay. Points of gaze are intact. We do not have a Snellen chart provided. However, if we were going to test for visual acuity, the patient would be standing 20 feet from the chart. She would cover one eye and read the line of letters that she can best visualize, and then she would uncover that eye and cover the other one and read from the line. At 20 feet, most people can read 20/20 or 20/15, but that is how we would grade her visual acuity. Okay. Next, I'm going to begin to inspect her ears. Patient has on earrings, but ears are symmetric with no lesions or masses noted. I'm going to inspect your internal ear. Okay, tympanic membrane is intact and thorough. Okay, tympanic membrane is intact and pearl. We are now going to perform the whisper test. I'm going to stand behind you and whisper, and you tell me repeat what I say.
Okay. Basketball. Basketball.
At this point, we are going to perform the Rhine test and Weber test to check for bone conduction and air conduction. I'm going to place this on mass starting process. You tell me when you don't hear it vibrating anymore. Or vibrating. You still feel it vibrating?
Mm-mm.
Okay. Now we're going to check for bone conduction. Can you tell me when you stop vibrating?
Stop.
Okay. Weber test and Rhine test have been completed, are intact. Patient's hearing and vibrations are bilateral. Okay. Now I'm going to inspect the nose. Nose is midline and symmetric. Okay. Nasal mucosa is dry, no polyps or masses noted. Now I'm going to begin to inspect her lips and her oral mucosa. Okay, lips are intact and symmetric. Can you open one and say ah? Okay, can you move your tongue left and right, up and down? Okay, patient has good dentition. Her oral mucosa is moist. Her tongue is midline with no deviations. Her uvula is also midline with no deviations. I'm going to now inspect her trachea and her thyroid. Okay. It is midline. Can you swallow for me? Any issues swallowing or tenderness or pain?
Mm-mm.
No? Okay. I'm now going to check her lymph nodes, preauricular, postauricular, occipital, submental, submaxillary, cervical, supraclavicular, and then the tonsillar. Lymph nodes are non-palpable, non-tender. Can you shrug your shoulders for me? Shrug against. Okay, push against my hand. Okay. Good. No tenderness noted?
Mm-mm.
No? Okay. Well, next we're going to move on to her cardiovascular system. First, I'm going to note for any jugular vein distension. No jugular vein distension noted. Carotid arteries are palpable. Now I'm going to listen with my bell. There are no bruits noted in her carotid arteries. I'm now going to listen to the temporal. No bruits noted. I am now going to listen with my diaphragm and with my bell to her heart sounds. I'm going to begin with my diaphragm. Listen to the aortic. Pulmonic. Third. Tricuspid. Mitral. I'm also going to note the point of maximal impulse. Okay, and then I'm going to go back through and listen with my bell. heart rhythm is normal. No bruits or murmurs noted. Okay. And now I'm going to begin the thoracic assessment. I'm going to inspect anteriorly, watching the patient breathe. Her respirations are even and unlabored. Her chest expands symmetrically. I'm now going to listen to her lung bases. Take a deep breath for me. Deep breath. Deep breath. And I'm also going to listen laterally. Anterior lung bases are clear for auscultation. No adventitious breath sounds noted. I'm just going to begin to palpate the thoracic area for any tenderness. Also going to palpate the ribs. Any tenderness? No. Okay, I'm going to percuss over the lung bases. Tenderness noted. Okay. Will you turn to the side for me? I'm now going to inspect her posterior lung bases. I'm going to auscultate and percuss and palpate. I'm first going to begin by palpating her spine, which is midline. No masses noted. Intact. Can you lean over for me a little bit? Any tenderness or pain noted? Okay. I'm now gonna listen to your posterior lung bases. Deep breath for me. I'm just gonna palpate. Any pain or tenderness?
No.
Okay. I'm gonna percuss over these bases. Any tenderness? Okay. No CVA tenderness noted upon percussion. Alright, you can turn forward for me, please. I'm now going to inspect her breasts. Do you normally perform self-breast exams? Yes, you do? Okay. Well, if you can, just sit up straight for me. Okay, I would just inspect for any masses or nodules. Can you slouch forward? And at this point, we're looking for any dimpling back. Okay. And if you don't mind lying down for me, we'll, okay, with one arm behind. Okay. And you can either palpate in a lateral motion, okay, for any masses or tenderness. Also want to make sure you palpate up under the, under the axillary, the tail of Spitz. Okay, other side. If you don't like, other side. If you don't like the lateral movements, then you can go in a circle around the areola and the nipple. Once again, we'll palpate up under the axillary for the talus stents. Okay, you can sit up. And when performing self-exams, the best time to do it is in the shower with the same motions to note for any masses or dimpling. You have any questions about the breast exam? Okay. All right, so now we're going to move down to the abdominal assessment. Patient's abdomen is round. She is pregnant. How far along are you?
8 months.
8 months. Okay. So I'm going to be gentle with the auscultation and the palpation. So first, I'm going to listen to her abdominal sounds. Please. Bowel sounds are active in all quadrants. I'm now going to just palpate. Now I'm going to palpate for the liver and the spleen. The liver is not palpable, nor her kidneys. I'm going to try to percuss over her. Solid organs. Dullness is heard over the liver. Okay. Please sit up now. We will now move to the extremities. Okay. All right. Any tenderness noted in your extremities? No? Okay, no lesions noted on the arms or the legs. Okay, can you hold your arms out for me? We're going to test your strength. Okay. All right. I'm going to also check your pulses. You can just relax. Okay, your radial and brachial pulses are 2+ bilaterally. I'm now going to check your reflexes. Just rest your arm. Reflexes are intact. You can hold your hands up. All right, and pull against the force. Push. Okay. Her strength is +5 bilaterally. Okay. To check for the inguinal arteries, we will. And then we're going to move down towards the lower extremities to check popliteal. If you could, would you remove your shoes for me? Okay, we're also going to check her posterior tibial and a dorsalis pedis. Okay. Lower extremity pulses are 2+ bilaterally. When we have your shoes off, you can go ahead and check for the Babinski reflex. A little ticklish, but negative for the Babinski. Okay. Also gonna check your strength on your legs, okay? Can you push up, push down, push up, and down? Okay, her leg strength is also 5+ bilaterally. I'm going to check her deep tendon reflexes, okay? Check the Achilles. Okay. All right, if you could stand for me. All right. Your shoes. All right. Can you walk on your heels? And then walk back on your toes. Okay, can you hop one foot? Okay, then hop on the other. Okay. And now we're gonna check for the Romberg test. If you could close your eyes and put your arms out in front of you. Okay, no swaying noted. Negative for Romberg test. Close your eyes and bring your finger to your nose. Okay, and then the other side. Okay, great. You can have a seat. We are now going to check your sensory function. If you close your eyes, I want you to tell me what this object is that I'm placing in your hand.
Can.
Okay. With your eyes closed, I want you to tell me what type of sensation this is that you feel. Was it dull or sharp?
Dull. Sharp. Dull.
Okay.
Dull. Sharp. Sharp. Dull.
Okay. Also, I'm trying with your lower extremities.
Dull. Sharp. Dull. Sharp.
Okay. Can you lift your legs up for me? Great.
Sharp. Dull.
Okay.
Sharp. Dull.
Excuse me. Thank you. Okay, we have completed sensory checks. I'm going to go back and ask you to close your eyes and tell me what you smell.
Oranges.
Orange is correct. Okay, completed the head assessment. Cardiovascular system is intact. Posterior lung basins were clear. No adventitious breath sounds. Abdominal sounds were normal. No CVA tenderness or masses noted. Her skin is intact. No lesions or breakdown noted. And I think this completes our physical assessment.